Healthcare in America is one of those things almost everyone has an opinion on, because almost everyone has felt the frustration firsthand. Whether that's a bill that didn't make sense, a claim that got denied, or a prescription you couldn't afford. So when the current administration says they want to fix it, it's actually worth understanding what's being proposed and where things stand. The centerpiece of what's being called the Great Healthcare Plan is really about two things: lowering costs and forcing transparency. On the cost side, the idea is that Americans shouldn't be paying more for the same prescription drugs than people in other countries. So the plan pushes to lock in lower negotiated prices. It also wants to make more medications available without a prescription, which cuts out the cost of a doctor's visit just to get something you probably already knew you needed. On the transparency side, insurance companies would be required to publicly post how often they deny claims, how long approvals take, and what percentage of your premium actually goes towards your care versus their own profits. The thinking is, if people can see that information, companies will be pressured to do better. There's also a separate but related push happening right now around fraud. The agency that runs Medicare and Medicaid says it stopped over $5.5 billion in suspected fraudulent payments last year alone, using AI tools to catch bad billing before the money even goes out. They recently froze new Medicare enrollments for certain medical equipment suppliers and held back over $250 million in federal Medicaid funding from Minnesota while investigating questionable claims. It's a shift from the old approach of paying first and investigating later. Here's the honest reality though. Most of the bigger proposals still need Congress to approve them, and that's no small thing. Polls consistently show that healthcare is an area where the public hasn't fully trusted Republicans to lead, and some separate proposed rule changes could actually raise out-of-pocket costs for people on Affordable Care Act plans, even if their monthly premiums go down. So the goals being stated are ones most people can get behind. Whether the full plan actually gets there is still a very open question, and one worth keeping an eye on. Thanks for watching.